Hello, and welcome to this video on a topic that may not be frequently discussed, but affects many couples, when erectile dysfunction meets vaginal dryness. As we age, both men and women may experience changes in their sexual health, with men facing the challenge of maintaining an erection and women experiencing vaginal dryness. These changes can be frustrating and impact a relationship's quality of intimacy and satisfaction. In this video, we will explore the causes and common reactions among those over their 40s when these two conditions coexist. We will also provide tips and solutions to help couples overcome these challenges. So, whether you are experiencing these changes yourself or know someone who is, stay tuned for valuable insights and advice. Before we dive into the details, let's first understand what erectile dysfunction and vaginal dryness are and why they occur. Erectile dysfunction, ED, is a common condition that affects millions of men worldwide. It is characterized by the inability to achieve or maintain an erection that is firm enough for sexual intercourse. ED can be caused by a variety of factors, both physical and psychological. Physical factors contributing to ED include chronic health conditions such as diabetes, high blood pressure, heart disease, and obesity. These conditions can affect blood flow to the penis, essential for achieving and maintaining an erection. Other physical causes of ED include hormonal imbalances, injury to the penis or pelvic area, side effects of certain medications. For example, medications used to treat high blood pressure, depression, and anxiety can contribute to ED. Performance anxiety is a common psychological factor that can contribute to ED. It can be particularly common in men experiencing ED for the first time or in situations with pressure to perform sexually. Smoking, excessive alcohol consumption, and drug abuse can also contribute to ED. These habits can damage blood vessels and nerves, making it difficult to achieve and maintain an erection. In some cases, ED may be a symptom of an underlying medical condition that requires treatment. Therefore, it is important to consult with a healthcare provider if you are experiencing ED to rule out any underlying medical conditions and receive appropriate treatment. On the other hand, vaginal dryness is a common condition affecting many women, especially those going through menopause or perimenopause. It is a condition where the vagina lacks natural moisture, which can cause discomfort or pain during sexual intercourse. This is because the moisture in the vagina is essential for lubrication, which makes intercourse comfortable and pleasurable. A variety of factors can cause vaginal dryness. One of the most common causes is hormonal changes, particularly during menopause or perimenopause. During this time, the body produces less estrogen, which helps keep the vaginal tissues healthy and lubricated. As a result, the vagina may become dry, thin, and less elastic. Certain medications can also contribute to vaginal dryness. For example, medications used to treat allergies, colds, and asthma can cause a reduction in vaginal moisture. Cancer treatments, such as chemotherapy and radiation therapy, can also cause vaginal dryness, as they can damage the cells that produce estrogen. Medical conditions such as autoimmune diseases, including Sjögren's syndrome and lupus, can also contribute to vaginal dryness. These conditions can cause the body's immune system to attack healthy cells, including those that produce estrogen. Other factors that can contribute to vaginal dryness include stress, anxiety, and smoking. These habits can affect hormone levels and reduce blood flow to the vaginal tissues, making it difficult to maintain vaginal moisture. If you are experiencing vaginal dryness, you must talk to your healthcare provider to determine the underlying cause and receive appropriate treatment. Treatment options may include hormone therapy, lubricants, and vaginal moisturizers. Addressing the underlying cause of vaginal dryness can improve your sexual health and overall quality of life. When ED and vaginal dryness occur together, it can create a challenging situation for couples. It can be frustrating and stressful, leading to decreased intimacy and causing strain in the relationship. However, it's important to remember that these conditions are common and can be addressed correctly. When faced with the conditions of erectile dysfunction and vaginal dryness, it is not uncommon for couples over 40 to experience a range of emotional reactions. One common reaction is to avoid sexual activity altogether. This can be due to anxiety or fear of experiencing discomfort or pain during intercourse, leading to frustration and isolation. Another common reaction is a sense of embarrassment or shame. Many people may feel uncomfortable discussing their sexual health concerns with their partner or healthcare provider, especially if they believe it is sensitive or taboo. This can be particularly true for older couples who may have grown up when sex was not discussed openly or frankly. Some individuals may even blame themselves or their partner for the situation. For example, a man with erectile dysfunction may feel inadequate or emasculated. In contrast, a woman with vaginal dryness may feel no longer desirable or sexually attractive to her partner. These negative emotions can strain the relationship and make it difficult to communicate openly and honestly. The good news is that these conditions are treatable, and seeking medical help can help couples regain their sexual confidence and intimacy. It is important to understand that erectile dysfunction and vaginal dryness are not a reflection of one's sexual ability or attractiveness. They are medical conditions that can be addressed with appropriate treatment. However, it's important to recognize that experiencing erectile dysfunction or vaginal dryness is not anyone's fault. These conditions can happen to anyone and are often caused by factors outside of an individual's control, such as hormonal changes, medical conditions, or certain medications. It is not so uncommon, contrary to what many people think, that partners in relationships may begin to look outside for their sexual fulfillment, leading to the feelings of betrayal, sometimes leading to marital separation or divorce. The good news is that several treatment options are available to help manage these conditions. For example, hormone therapy may be recommended to address hormonal imbalances that can cause vaginal dryness in women. For men experiencing erectile dysfunction, medications such as sildenafil or tadalafil may be prescribed to improve blood flow to the penis and enable a firm erection. There are also prosthetic devices that may suitably recommend. The secret is to seek early medical help. In addition to medical treatment, communication between partners is essential in managing these conditions. Open and honest communication can help build trust and intimacy and ensure both partners feel comfortable and supported. This may involve discussing concerns or anxieties about sexual activity, trying new sexual positions or techniques, or using lubricants or other aids to enhance sexual pleasure. Ultimately, managing erectile dysfunction and vaginal dryness requires a multifaceted approach that addresses physical and emotional factors. It's essential to seek medical help and work with your healthcare provider to identify the underlying causes and develop a personalized treatment plan. Many couples sometimes consider the use of sex toys as inappropriate due to culture or religion. A careful consideration and understanding of suitable devices for both male and females can be very helpful in finding the way forward. With the right treatment and communication, many couples can successfully manage these conditions and enjoy a fulfilling sex life. So there you have it, folks. While erectile dysfunction and vaginal dryness may seem daunting, they are common conditions that can be managed with the right treatment and communication. Don't let these conditions stand in the way of a fulfilling sex life. Talk to your healthcare provider, explore practical solutions, and keep the lines of communication open with your partner. With patience, understanding, and a little creativity, couples can continue to enjoy intimacy and pleasure, no matter what challenges may arise. Thanks for watching, and we'll see you in the next video.